Can we restore vision or cure blindness? Elon Musk just announced that his company Neuralink is going to attempt to restore vision and cure blindness with his cutting-edge brain implant technology. Neuralink just recently obtained FDA approval to start human trials. January 29, 2024, they actually implanted the N1 chip in the first human trial. So why are they doing this? Let's back up and actually get a better understanding of how our visual pathway works. If you're looking at me, light rays are actually coming into your eye, hitting your retina, and that signal is being sent along the optic nerve to the back of our head to a part called the visual cortex. And that's where we get the perception of our vision. Now, in some patients, there's a disruption with this pathway. And whether it's within the eye or the optic nerve, we lose our vision. So what Neuralink is trying to do is stimulate our visual cortex in a certain pattern that we would actually perceive an image. And what's going on is they are actually replacing it with a digital camera. That could be with a pair of eyeglasses that has a camera system. The camera would then communicate with the phone, which converts the video to a signal to send to the N1 chip, which is implanted in the brain, which communicates and actually would allow the patient to see. Now, this is in the very early developmental process, and Neuralink has actually obtained $320 million worth of funding for this research project. Brain-computer interface technology has actually been around for decades. It all started with using thoughts to control prosthetic limbs. Now, this is not just a simple cataract procedure where we're dealing with the eye. This is actually neural surgery. You're having surgery done to the brain. What's going to end up happening with this type of surgery is part of the skull is removed. It's about the size of a quarter. And this is performed by a robot called the R1 robot, where it will insert electrodes into our brain in a very precise pattern. And it is actually so precise that if the patient is moving just by breathing, it'll detect the motion and actually will still be able to insert these very precisely, avoiding blood vessels. The N1 chip will then replace where the skull was removed. Here's an actual visual demonstration that Neuralink released during their press conference of what a patient would perceive using the N1 technology. As you can see, there is no color in the image, but it is quite impressive that with computer technology that a blind patient could potentially detect this. So what do you think? Would you ever consider putting an N1 chip in your brain? Let us know.